Navigating the intricate process of obtaining health insurance approval for Wegovy, semaglutide, can be overwhelming. Wegovy, a medication crucial for weight management, cardiovascular event risk reduction, and associated health issues, often requires jumping through several hoops before receiving the green light from insurers. This guide aims to walk you through every crucial step, ensuring that you maximize your chances of getting the necessary approval. Step 1. Consult with your healthcare provider. Initiate a thorough discussion. The first step in this process begins with a comprehensive consultation with your healthcare provider. You will need to discuss why Wegovy is critical for your treatment, highlight any challenges or failures with previous treatments, and discuss how your current health status necessitates a switch to Wegovy. Letter of medical necessity. Request your healthcare provider to compose a detailed letter of medical necessity. This document is vital and should encompass your medical history. Document how weight issues have impacted your health and quality of life. Previous treatments. Outline all prior treatments and therapies, including their ineffectiveness or adverse side effects. Specific needs. Explain why Wegovy is the optimal choice, detailing the expected benefits like improved weight management and reduction of comorbid conditions such as diabetes or hypertension. Health risks. Include any potential risks or deteriorations in your health if Wegovy is not administered. Step 2. Understand your insurance policy. Review the formulary. Access your insurance policy's formulary to check if Wegovy is covered. Most formularies classify medications into tiers, each with varying coverage levels and copayment requirements. Knowing the tier classification of Wegovy will help you anticipate costs and coverage likelihood. Insurance company requirements. Investigate the precise criteria your insurance requires for covering Wegovy. These might include prior authorization. This is a common process where your insurer will decide if Wegovy is necessary based on the information your healthcare provider submits. Step therapy. Some plans require you to attempt and document the failure of other drugs such as Adipex, Phenterman, Contrave, or Symia before they approve Wegovy. Health metrics. Specific health criteria, such as a particular body mass index, BMI, level over 30, prior history of heart attack, stroke, peripheral arterial disease, PAD, or documented previous treatment failures, may need to be met. Step 3. Complete prior authorization. Submit with precision. If prior authorization is required, work with your healthcare provider to gather and submit all necessary documentation. Typical documentation includes letter of medical necessity, the comprehensive letter highlighting why Wegovy is essential, full medical history, your healthcare records detailing previous treatments and their outcomes, supporting evidence, any additional evidence that underlines the necessity, such as laboratory tests and doctor's notes. Consistency and accuracy. Ensure that the documentation aligns perfectly with the insurer's requirements to avoid unnecessary delays or rejections. Step 4. Appeal a denied claim. Understanding the denial. If your initial request is denied, contact your insurance company to get a detailed explanation. Understanding the exact reasons behind the denial is crucial for a strong appeal. Formulate an appeal. With your healthcare provider, draft an appeal letter addressing every point of the denial. This letter should respond thoroughly, directly respond to the denial reasons with additional or clarified evidence, reiterate medical necessity, reinforce that this medication is not being used for cosmetic purposes, but rather that the Wegovy will help prevent worsening of current health conditions and prevention of future diseases. Emphasize medical facts and provide supporting documentation. Include new information. Provide any additional evidence or arguments that support your case. For example, include worsening blood pressure, new diagnosis of sleep apnea, high cholesterol, coronary artery disease, etc. Persistent follow-up. Appeals can be time-consuming, necessitating regular follow-ups. Keep meticulous records of all correspondence and conversations with your insurance company, documenting dates, times, and representative names. Step 5. Seek manufacturer assistance. Patient assistance programs. Novo Nordisk, the manufacturer of Wegovy, offers patient assistance programs for those who struggle with the out-of-pocket cost. Visit their website or contact their customer service for details on eligibility and application procedures. Savings and coupons. Look for savings cards or copay assistance programs provided by Novo Nordisk. These can substantially reduce your out-of-pocket costs, making Wegovy more affordable while awaiting insurance approval. Step 6. Consider alternatives. Discussion with your provider. If insurance approval remains elusive, talk to your healthcare provider about alternative medications that might be more readily approved by your insurance plan. They can suggest other drugs that are effective for your condition, but easier to get approved. Discuss more affordable options such as semaglutide obtained from a compounding pharmacy for a fraction of the cost of brand-name medications like Wegovy. This requires a prescription from the provider. Lifestyle adjustments. While waiting for approval or considering other medications, integrate lifestyle modifications into your treatment plan. A holistic approach involving diet, exercise, and behavioral therapies significantly improves outcomes and complements medication therapy for even greater result. Step 7. Maintain detailed documentation and communication. Organized records. Keep copies of all documents submitted to the insurance company, including medical necessity letters, prior authorization forms, and appeal letters. Well-organized paperwork can streamline the process and provide a solid foundation for appeals. Communication log. Maintain a detailed log of every interaction with your insurer. Note down the dates, times, names of representatives, and the specifics of each conversation. This log can be invaluable if discrepancies or misunderstandings arise later. Navigating the approval process for health insurance coverage at Wegovy can be thorough and at times complicated, but it is achievable with careful, persistent steps. Having a comprehensive strategy, starting from a detailed consultation with your healthcare provider to maintaining meticulous records, can significantly enhance your chances of success. If your initial efforts do not yield approval, appeals, manufacturer assistance programs, and exploring alternative treatments can all serve as viable options. Always keep open lines of communication with both your healthcare provider and insurer, ensuring that all submissions are comprehensive and meet the necessary criteria. Understanding your insurance policy, staying informed about the necessary procedures, and being proactive with follow-ups are key in securing the approval you need for your health and well-being. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up and subscribe to our channel for more tips on managing your health and navigating insurance approvals. And for the latest updates and tips on managing your healthcare and insurance coverage, subscribe to our school group now. See you when the next one. Bye for now.